In the last half an hour, the first AstraZeneca vaccine has been delivered in the UK in the last hour or so. It was given to an 82-year-old patient at the Churchill Hospital in Oxford. We can see him now. He's Brian Pinker. He describes himself as Oxford born and bred, and he said, shall I read you the statement? It's rather lovely. He says, "I'm so pleased to be getting the COVID vaccine today. Really proud that it's one was invented in Oxford. The nurses, doctors and staff today have all been brilliant, and I can now really look forward to celebrating my 48th wedding anniversary with my wife Shirley later this year."
Well, happy anniversary. Sam Foster was the chief nurse there who was administering the vaccine this morning, and we've spoken to her already on BBC Breakfast this morning. She was talking to our medical editor Fergus Walsh, who is back outside the hospital in Oxford this morning. Incredibly busy, Fergus, and a really big step forward this morning.
It is a huge step forward because this vaccine, not just for the UK but globally, will have a major impact. It is far cheaper than the Pfizer jab, far easier to transport and store. It can be transported and kept in a fridge, unlike the Pfizer jab, which has to be moved at -70. So it's going to have a big impact. It can go into every care home easily within the next few weeks, and it can go to anywhere in the world because AstraZeneca has said it will produce 3 billion doses at cost this year, and it's promised also never to make a profit from low and middle income countries. Well, I'm delighted to say that the global head of clinical trials of the Oxford-AstraZeneca vaccine, Professor Andrew Pollard, is with me. Professor Pollard, I think you've just received your dose too.
I have just received my dose as a healthcare worker here in Oxford, and I'm really delighted to have been able to do so. It's an absolute triumph for all of the team who've been working on the vaccine this year.
And we are just a few hundred metres from where the first trials were done in April, a few hundred metres from where the team at the Lister designed this. I mean, extraordinary that a university, albeit a prestigious one, should produce a vaccine in the space of a year that could have an incredible impact on bringing this pandemic under control.
It's an amazing academic collaboration that brings us not just here in Oxford but at the trial sites around the UK and internationally, with academic groups driving forward this programme to meet this point today where we see the first doses rolled out.
So when you saw Brian Pinker getting his jab, the vaccine approved, what was running through your mind then?
I was so pleased to see someone here in Oxford who's been brought up in Oxford so excited to receive the first dose of the vaccine which was developed here.
And I know it's just being limited to a few centres on day one. Why is that?
Well, it's been limited to a few centres just to get started and to work out all the logistics. But I'm hoping that the NHS will be set up for a major rollout over the weeks ahead.
Now, in terms of the sort of level of protection it gives, people are getting one dose and then they're getting their second dose 12 weeks later. Now, do you have any idea what level of protection, because there's been all sorts of numbers flying around, what level of protection it will give people?
Well, in the clinical trials, once the immune response kicks in, and that takes a few weeks after you've been vaccinated, we've seen up until the second dose, around about 70% protection.
And there is also potentially protection against severe disease, which is really more important.
Well, the information from the trials really shows that the vaccine is protecting people against severe infection and hospitalisation. In fact, after the immune response has kicked in, we didn't see anyone who ended up in hospital from that point onwards. And the 70% is really against mild disease where we're seeing that protection. So I think this is extremely good news.
Now, in terms of people coming forward, there are something like 30 million people in the priority groups, over 50s, frontline healthcare workers like yourself, and then people with underlying health conditions. How soon do you think that group will be protected?
Well, there's a huge logistical challenge, but I think the NHS is very much up for it, and there's lots of work going on supply that AstraZeneca is responsible for. So I'm optimistic that we're going to get there in the months ahead.
And in terms of long-term protection, because people will eventually get their second dose, you, I think, found from your trials that a bigger gap may actually have given better overall protection.
Well, we certainly saw better immune responses with a longer gap. At the moment, the numbers are a bit small to be absolutely sure that translates into better protection, but we think it should. And so I think there's no harm in having a longer gap, and there may be a benefit as well.
Now you're also a doctor here. You've seen what's going on in hospitals. It's pretty serious at the moment.
I think this is a really critical moment. We are at the point of being overwhelmed by this disease. So I think it gives us a bit of hope, but I think we've got some tough weeks ahead.
Okay, Professor Pollard, thank you very much indeed. So, as Professor Pollard said, the NHS really under pressure. So the rollout of this vaccine really can't come soon enough, but it is a bright moment, a bright spot in what otherwise is some very grim news about what is happening to the NHS, the intense pressure it is under from the new variant of coronavirus.